you have any questions? Any question at all?
22nd, huh?
Good? Alright, then here we go. Let's continue. So, really quick, I want to make sure you guys remember this. Okay, especially on contact, don't forget that MRSA, if MRSA is on the wound, the urine, the blood, then it's contact. If it's on sputum, then it becomes droplets. Okay. The other thing I want you to remember, C. diff is contact, hepatitis A is contact, herpes, especially herpes, don't forget, and scabies are also contact. Don't forget those illnesses, okay, they're contact. Then, on droplet, don't forget, pertussis is droplet. What's the other name for pertussis?
Cough.
Whooping cough, right? Whooping cough, alright? That's the one where the manifestation is what kind of cough? Barking, right? Barking, right? So don't forget, pertussis is droplet. MRSA of the sputum is also droplet. Meningitis is droplet, and RSV. Okay, don't forget, RSV is droplet. Okay, RSV is droplet. Because that RSV comes out on our peaks. Okay, so people forget that RSV is droplet. Okay. And then airborne, don't forget MTB, right? Measles, tuberculosis, and varicella, which will also include shingles. Shingles, because shingles is, you know what causes shingles, right? It's varicella. So don't forget that one. That's our airborne. Okay. And then yesterday we talked about neutropenia, okay, which is another type of precaution. What kind of room do we put a neutropenic patient in?
Positive
room, right? And for airborne, what kind of room?
Negative.
Alright, very good. Great, good job. Okay, next. I want to go over this. We went over active shooters, right? What did they say was the first thing to do?
Turn off your cell phone.
Turn off your cell phone, right? Before you do anything else. Or you hide, off the table, or things like that. The next one is chemical disaster. So really quick, I just want to make sure everyone's aware of this. I put this also already on our PowerPoint, but I'm not sure if you guys tried to answer it, but let's go ahead and answer it. The community is affected by a chemical spill in a nearby industrial area. Which action should the nurse prioritize for community education regarding safety? So what are the things that we should do for an outdoor chemical spill? Okay, so let's take a look. Letter A, encourage residents to stay indoors and close windows. That's correct.
Yes.
Right. All right. That's correct. So always remember, if the disaster, especially if it's chemical, is outside, don't bring the patient outside. Keep them where? Keep them in, right? Close the door, close the window, close the air vents, right? Make sure you turn it off, okay? And they should be away from windows and doors. Okay, and what do you do with the bottom of the door?
Put
a towel. So yes, so A is correct. Right? And then this one, is this encourage residents to drink plenty of fluids? So that would be wrong. Doesn't matter whether they drink fluids or not. Okay. Suggest using public transportation during the evacuation. You should not what?
Go outside. Yeah.
Right? You should stay where?
Inside.
Inside. Okay. Recommend wearing regular clothes, mask for protection. No, that doesn't really matter.
Okay.
Next one.
Wet towel. Yeah.
Yes. Or place a wet towel under the door. Yes. What do you do with it? Because you want to close the gap. Don't want any gap. Don't want any gap at that door. Evacuate outside. We know that is wrong. So the answer is A and E. Alright, very good. Okay, so A and E. Those are the answers. Encourage the residents to stay indoors, close windows and doors, and place a wet towel under the door. Okay, now, of course, it's different in the case of a fire, right? If it's a fire in the facility, we have to follow what?
Race.
right? Race means
Rescue,
rescue,
alarm,
alarm,
contain, extinguish,
evacuate, or
extinguish.
extinguish. Right. So let's say the situation is you are walking by the hallway, you find or you saw that in the patient's room the trash can was on fire. What would you do first?
Take the patient out
Patient
there.
from the room. Then what would you do second?
Alarm.
Activate the
Alarm.
Then what would you do?
Then close the door.
Close the
Door.
fire door, right? And then
Extinguish.
extinguish, right? Extinguish or evacuate if you can. Okay. Don't forget. All right.
Okay.
Very good. Always remember, rescue the closest patient to you first, not the one that are furthest. Rescue always the one that's closest, alright? And also rescue the one that can move
I believe.
or help themselves before you actually rescue the one that you have to carry or you have to transport. Okay, because the goal is what? To rescue as much as you can. Right? Is that clear, guys? Okay? Alright, very good. Okay, and then if you're going to extinguish and you're going to use an extinguisher, the proper step is pass, right? Pull, aim,
Sweep.
sweep. Where do you aim? The bottom
Out
of
of the fire.
Fire. Very good. Good job. Let's know it. Good with that one. Next one. Next sample. A nurse is teaching a new parent about car seat safety. So this is on car seat safety for their infant. Which statement by the parent indicates a need for further education? So we're looking for something that the parent said that is what? Wrong. So don't forget, you're gonna get, I think, 2 questions on car seats. So don't forget, okay, car seats. We're gonna talk about car seats a little bit after we answer this. What do you think is something that's wrong?
See? I don't know. I'm not good at these.
Better?
See?
Who says A? Who says B? Who says C?
Yeah.
Who says D? Everyone's absent? Okay.
It's either B or C.
There are a few of you who answered. Alright, so let's go ahead and answer this. Okay, go answer it. I should place the car seat in the back seat of the car.
That's
Does that
true.
require further education?
No.
Because that's true. That's correct. Now the question though is the car seat by the side or by the center?
Should be by the
The
center.
answer is center.
Yeah.
This is the center. Why? If any accident is gonna T-bone, then at least the car seat is far away from the door that's going to close up or fold. It's also away from what? Inflating
Airbags?
airbags that can also kill the baby. So you want the car seat to be center. Right? So by placing it at the back, that's correct. Now, if you don't have a back seat, you can place them in the front as long as you turn off the
Airbags.
Okay, there's a way to turn off the airbags. Right. So the next one, my baby can use a forward-facing car seat as soon as they reach 20 pounds. That is the one that requires further education. Why? Because minimum is 2 years or at least 30 pounds.
30 pounds. Okay.
Forget, okay? Minimum is 2 years or at least 30 pounds. Right, so that would be wrong. So that's the right answer. Okay, that's the one that requires further education. Okay, the next one, the harness should be snug against my baby's shoulders. That's correct. Don't forget this. Okay, it's going to be right here. It should be on the shoulder, not on the chest, not on the thumb. Okay, it's right here, shoulder. So it's going to be like that. The harness. Okay. Alright, so that's correct. That doesn't require further teaching. I should keep my baby in a rear-facing car seat as long as possible. Correct. The longer you keep them in a rear-facing car seat, the safer. Okay? So if, let's say for example, the baby can see the mom, then that would be wrong, right? Because that means that the baby is what? Front-facing, right? Okay. The other thing to remember, don't forget this, and this always comes out of the exit, is there has to be a towel or a cushion. But take note, you gotta make sure that you read it carefully because if it says back of the head, that would be wrong. It should be where? Around the head. Okay, what's the cushion for? To prevent the head from wobbling. Okay, is that clear, guys?
Mm-hmm.
Alright, very good. So don't forget that about our Car seats. Okay. Any question on car seats?
That's you.
All right, next one. Walkers and canes. The patient has just been fitted for a cane. Ask how to use it correctly. What is the nurse's best response?
Oh,
This
opposite of your
What's
weakness.
this topic? You're about to.
I will say A.
I can't remember, but this is on that. But we will discuss
A.
other topics.
Because B says always.
Alright, what's the answer?
A?
Letter?
A.
Alright, so the answer is letter
A.
So let's take a look, okay? But you are correct though, it's letter. It is. So always remember, canes are actually used on the
Strong
strong
side.
side. So don't forget that, okay? You don't put the cane on the weak side. The cane goes on the strong side of the patient. So let's say, for example, you have a post-stroke patient. The patient has a left-sided weakness, right? Where would the cane be?
Right side.
Right, because they're weak on the left. Who's actually on the left? The CNA. So don't forget that, okay? Always remember that. That the nurse is actually the one that goes on the weak side, while the cane is the one that goes on the
Strong side.
strong side. Okay, now let's take a look at B. You should always lead with the cane first. So
It says always.
the word always, you already know it's wrong. Because there will be variation. Although we do use the cane first, followed by
Like
the bad leg, followed by
good leg.
Okay, but it's not always the case. That's what we do. Right. The other one is the cane should be used only when you feel unsteady. Again, wrong, right? Because of the word only.
Only.
You have clues. Very good. You guys are seeing that already, right? So you can really just pick, either A or B. You can hold the cane on either hand. Well, that's wrong, right? Because you hold it where?
Strong side.
On the strong side. Okay, so there's another variation of the question, and this one is on transfer. So let's say, for example, I'm the patient, right? I'm sitting down on the side of the bed. Again, left-sided weakness. You are the nurse. You're gonna transfer me to the wheelchair. So the question is, where should the wheelchair be? The next one is, how should the wheelchair be facing, right? And where should the nurse be? So let's answer the first one first. Where should the wheelchair be? So
Strong side?
left-sided weakness, strong right side. Where should the wheelchair be?
Right side?
The wheelchair should be on
Right side.
the right side. So always remember, whatever is the device, whether it's a cane or a wheelchair, the device goes where? On the strong side. Where does the nurse go? On the weak side. Okay, so if I'm a left-sided weakness, this is where the CNA or licensed nurse is going to be, on my left side. Right? Then I am going to be pivoted on a chair that is 90 degrees, 45, or 180 degrees.
45.
45 degrees facing the bed. Is that clear, guys? Alright, so we're good. Any question on that? So always remember, devices goes where?
Strong side.
Strong side. Nurse goes on
Weak side. Affected. Yeah.
Okay. Right, and don't forget, the wheelchair should be facing 45 degrees, not 90, not 180. Okay? Alright, the next one. A nurse discovers that the medication was administered to the wrong patient. What is the nurse's most appropriate action?
Incident report. Yeah, incident report. What do you think's the answer, guys? B.
Alright, so the reason why I put this here, because there's actually two things that they'll ask on the incident report. One is events that require an incident report, and the other one is how to write or when to write. Okay, so let's answer it. Someone administered the wrong medication or the medication to the wrong patient. That is a what? That is a medication error, which is an example of something that would require what? An incident report. Now, other than a medication error, what else would require an incident report? Give me some more example. Falls or injury to the patient, nurses, or visitors. Always remember, nurses and visitors are actually part of what? The incident report, not just the patient. If a nurse gets hurt, that's an incident report. If a visitor gets hurt, that's an incident. Okay? So the other one is this one. You forgot the medication, or you gave the wrong medication, right?
So medication errors.
Or you gave it to the wrong patient, right? It's the right medication, but the wrong patient, so it's still a medication error that requires what? An incident report. Any other example of an incident report? Missing items, theft,
Okay.
right? Yes. Missing items.
Missing items.
Theft. Right? That's another one. Okay, so don't forget that those are examples of incident report. You fail to carry out an order. That means you omit. Okay, that's also an incident report. Okay, so if a medication was administered to the wrong patient, what should you do? Complete an incident report. Now, when you write an incident report, can you actually make speculations or suggestions?
Objective.
It has to be what? Everything that you
Objective,
just witnessed. You didn't witness it, can't write it, right? So let's say, for example, because they might ask you on how to write it. If you see a patient on the floor, right, can you say that the patient fell?
No.
No, you're going to document what? Patient
witness,
on the
floor.
Now, if the patient said, I slipped from my bed and I fell,
Patient
can you
stated.
write that? Yes, as long as you write it in
Quotes.
quotation. Yes. Patient stated, I slipped from my bed and fell. So you're going to put it in quotation. Right? You're going to put it in quotation. Right? Alright, so the other thing. Incident report does not go to the patient chart. And you can't actually what? Document about it. You cannot write about it. Okay? But you can write of what happened and what you did for the patient, but you can't write there that you made a incident report. You also can't make a copy of it. And who actually gets the incident report?
Nurse manager?
Risk manager.
Risk manager.
Very good. The incident report goes to the risk manager. Right? That's where it goes. Again, you can't make a copy, you can't write notes about it. It goes directly to the risk manager. Right? Okay. It's another one. A nurse completes an incident report after the patient falls. What is the nurse's responsibility regarding follow-up action?
B.
What's the answer?
B.
B as in?
Boy.
Boy, that's right. The nurse should ensure the report is submitted to the appropriate supervisor or risk management department. The risk management. Clear with that one now, guys? Alright, that's it. And then go to Pharm.
Okay. We did it. Okay, where's my form?
First up, the roads.
Alright. Saan ka nagda? Ito. Lumpia. Lumpia. I'm just making you look at it.
Oh, I was like,
Small egg rolls.
oh, they're tiny egg rolls.
Yeah. Right?
I didn't know that.
They've been here all day. Malamig na pero masarap pa. Ano ba? Still don't know what the hell that is. Oh, measles.
Alright guys, here we go. Pharm.
Okay.
Just a few things. Your exit will have dosage down, but it's not really easy. It's very hard. As long as we focus on E over H times Q or reconstitution math, the other one that might come out is intake and output, and then the other one is IV fluid. So those four things, those are the usual ones. If a question comes out on weight conversion, then you just have to remember that 2.2 pounds is how many kilos? One, right? So just don't forget that. So before we go to the dosage calc, here's the basics of pharmacology because this is going to be there. So a lot of times the question on the basics of pharmacology is related to medication administration. So we have to remember that there are 7 rights to medication administration.
Oh, it's 7 now?
Which is, of course, knowing the right medication. Okay, knowing the right medication. So I'll show you how this question will come up on your exit once we go to the next slide. The next one is knowing the right patients. So, most likely, guess what they're going to ask here? Patient
Identifiers.
identifiers. Correct. Alright, so what are the acceptable patient identifiers?
Full name.
Medical record number, name. Will you take Mr. Wilson?
No.
What kind of name?
Full name.
Full name.
First name
And last name.
last name. Alright? Okay, full name. Cannot be the first name, cannot be the last name, it has to be the full name. Okay, so medical record number, full name, date of birth, and
Phone number. Pictures.
phone number. Right? Now you can also use pictures, okay? And of course, other adults if the patient is a child.
Yep.
Right? Or if the adult patient is nonverbal.
Okay.
Okay? But of course, picture would be the best one as long as you have the picture. And don't forget, phone number is also an acceptable what? Identifier. Phone number. Okay, don't forget that. Now, how about the bed number?
No.
Room number?
No.
No. Very good. Don't forget that. Those are the acceptable identifiers. And always remember, if your patient is a child, do not ask them questions. Do not ask them their name,
Use the
do not
caregiver.
ask them their date of birth, their medical record number. What do?
Talk
Use
to
a
the-
picture,
yeah.
or ask the adult that's with the child if this is the
Caregiver.
actual patient. Okay, is that clear, guys?
Med patient.
Very good. Next one. The right dose. That's where dosage calculation is going to come in. And we're going to go to that page soon. And then the right time. Okay, what's the right time? The right time is an hour before,
Or
an
hour after.
after. So if it doesn't happen an hour before, an hour after, what is that?
Better.
It's an
Error?
incident
Oh, it's the report.
report. It's a medication error. It's an incident report. You have to assess your patient, report that to the charge nurse, and then the physician. Okay? So you have to make sure that medications are administered within an hour before, an hour after. It cannot be later than that, because if you delay, then that would be a medication error. Okay, now, very important as part of time. What does, because they're going to ask you this, what does the acronym STAT stand for? STAT.
Right away.
S-T-A-T. STAT.
Within 30 minutes to an hour.
Right now. That's right. Right now.
Right now.
Right, so don't forget that, okay? They're going to ask you that. STAT. Right now. Okay? That means you're going to give it right now. Not an hour, not 30 minutes. When are you going to give it?
Now.
Right now. Okay? Alright, next. The routes. There are different routes. We're going to discuss that once we go to the next slide. Indication. What does indication mean?
Purpose of, yeah.
What is it for? So as we go and we start going into the different medication in our PowerPoint, you need to know what it's for. Because they're going to ask you what? Therapeutic effect of the medication. That's how they will ask you on the test, whether it's adverse, and the next thing they always ask is therapeutic. What is the benefit that the patient gets from the medication? And then, of course, the right documentation. Right? Alright. So, here we go. Before we go to our next slide, we have a practice question, and then we'll practice on writing prescription. There's actually a question on identifying how to write the right prescription. But let's answer this first on the rule of medication administration. The nurse is caring for a client in a medical surgical floor. At 12 noon, the physician discontinued the IV fluids. What medication can the nurses give?
What? That's what I don't even know what the.
What do you think, guys? If you were the nurse, what would you give your patient?
Prayer.
So this kind of
Enough
like
information.
reduce your ability to write and read prescriptions. Alright, so let's take a look. If you look at it, there's actually clues. It's just clues. So what's the clue? What's the clue? There's only one option here that's different from everything else, which is what? Yeah. So that is the right answer. Right? Now, other than the administration time, you also need to know your medication. Right? You have to know what the medication is, because that's how they're going to ask you on the test. Furosemide is the medication that is known as
Lasix.
Lasix is a diuretic, which means this will result into an increase in urinary
output.
And when that happens, what can happen? It can actually decrease
Potassium.
blood pressure.
Oh, blood pressure.
So before you give it, you don't have any data supporting what? Blood pressure, so it's not safe. The other thing why this is not safe is because the medication is given twice a day. Remember, if you have a medication that is to be given twice a day, how would you know you can give the dose if you don't know when the first dose was given? Don't forget that. Very important to know. Medication with multiple administration time each day requires that you know the initial administration time. Okay? You need to know that. Okay, which is also what? The same as this. This is to be given when? 3 times. Where was the first one given? We don't know. Don't know. So can we give it? No, we can't. The other one is propranolol is actually what?
3
A
times.
beta blocker. Correct. Remember this. This one is the beta blocker that's going to be in our exit. So it's a beta blocker.
Bless you.
Bless you. Which means it actually blocks epinephrine, right? And the way it works is it lowers the heart rate to lower the what? Blood pressure. So how do we know if we can safely give it without having the blood pressure? Right? So we need a baseline blood pressure before we can give this. Right? So don't forget that. Okay? And then of course this one, another big one on our exit. This is very famous, especially because of heart failure. Digoxin. What is something that you need to have before
Apical
you give digitalis?
Apical pulse.
Apical pulse. So you can't give a digitalis without knowing the apical pulse, right? For an adult, it has to be at least 60 or more. For children, it has to be 70 or more, correct? And for infants, it has to be at least 90 or more, right? So remember that. Don't forget that for DIG. That you can't give DIG unless you know the apical pulse. Okay? Right, so that's what I meant about reading the medication, and especially, although my focus here was this, because this was a test on administration time. Right, so don't forget that if you have PID, that means you have to know when was the first dose was given first, right? Before you can give the other dose. You have to have a starting point. But this one, because it says daily, and what is pantoprazole? It is
PPI? Yeah, PPI.
tonics, which is a medication for GERD, right? So it's a proton pump inhibitor, which actually stops the stomach or the hydrochloric acid cells from producing hydrochloric acid. So there's really no parameter that's needed, and plus it's only given when? Once a day. So you don't really need to have a starting point, right? Because it's given once a day. Although it's best given early in the morning before
Breakfast?
eating for meals. Okay. Right, is that clear, guys?
Yes.
Okay, one more thing. The next one, on writing prescription, they're gonna ask you how to write telephone orders. Alright, so telephone orders, how to write telephone orders. So when you write telephone orders, you need to have a date, right? You need to have a time. You need to have the medication, the dose, the form, the route, the frequency, and what it's for. Right? That's what you need to have. Right? So always remember this though, on an exam, when this comes out of your exit, is that the one that matters the most is this. This area here. Okay?
So,
Even though you don't have this,
dosage.
when was the order given, the date and the time, this is still the most important thing. Why? Because it tells you everything about the medication. So let's say, for example, right, you have, let's say, you have this.
Route. Frequency.
You have this, right? But then you don't have this. Okay, and then you have another one that has this. But you don't have the date and the time. Which one though is the right answer? First or second? Second. Okay, so remember that. As long as you have the completed medication order, even if you don't have the date and time when it was given, that's still the best answer. Because through this order, you can actually administer the medication. It is complete on how you're going to administer it. Is that clear, guys? And then when you get a telephone order, what's the responsibility of the nurse?
Feedback.
Read back and verify. And make sure that the doctor signs it within
24 hours.
24 hours. Very good. Don't forget that. We're going to ask that, okay? So again, the responsibility of the nurse is to read back and verify and make sure that the doctor signs it within 24 hours.
Order within
Or, yeah, you need another nurse to verify each order. Good? Any question? No? Alright, very good. So, as I mentioned, this is gonna be what's gonna be on our dosage now. Alright, so just don't forget, intake and output. What you need to remember here is that 1 ounce is 30 ml. Okay, so don't forget that 1 ounce is 30 ml. But this is basically, what's probably going to be there in our dosage now. This one, reconstitution math, it sounds hard, but it's not really hard. It's just confusing for someone, but I'll explain it to you guys. This is a reconstitution math. There you go. Go ahead and answer that. That's a reconstitution. Let me know what you think is your answer.
ordered. Uh, 150 divided by 250.
Did everyone get 0.6?
Yes.
Alright, so very good, very good. Looks like you guys got this then. So not a problem. So reconstitution math, basically in reality, it's also just a B over H times Q. Same thing, right? Because whatever is the liquid that you add with the medication, you don't use this, right? It's just there as a distractor. So all you need to do is get the 150, right? Divided by whatever is the last mixing, which is 250, so you get 0.6.
Wait,
Right
what?
now,
What
very
are those letters?
important. When you write your answer, do not write 0.6. That would be wrong, right?
0.6.
You have to do what? 0.6. Also, don't write units. You start writing letters like ml, ounces, kilogram. Even though your answer is correct, it will mark it wrong. Because you will read that the instruction says numeric values only. So what does that mean? You can only write what?
Numbers.
Numbers. Okay? You can only write numbers. Right now, the other thing you have to remember is rounding, right? So when you round, remember that this is thousands, this is hundreds, and this is
Tenths.
tens, right? So let's say, for example, that's the answer, but they're asking you to round it to the nearest tens. What would be your answer?
0.1.
0.1,
1.
all right? So always remember that if your number beside what it wants you to round is between 1 and 4, you keep the same number. But if it becomes like this, round your answer to the nearest tens. What would be the answer?
0.2.
It will be
0.2.
0.2. Alright, 0.2. Are we good with rounding? Alright. Anyone have any questions?
What do those letters mean? D over H times Q?
Oh, doctor's order, what you have on hand multiplied by the quantity.
Oh, okay.
D over H times Q. That's just how I remember. Yeah, so the doctor's order divided by what's on hand multiplied by the quantity.
D over
Okay,
H
we clear with that?
times.
Alright, the next one. Make sure you really don't have any question, okay? If not, forever hold your peace. Alright? You don't want to miss easy points, okay? IV drip rate, what's our answer here?
5. Doctor's order divided by. I already forgot. Okay, whatever. $60 GTT. So 60. 400.
Alright, what did everyone get? What did we get? 50? Did everyone get 50?
Sure.
Those who didn't get 50, do you want to know how it become 50? Okay, so let's do it, right? So IB so drip rate is equals to volume in ml divided by the time in minutes multiplied by the drip or drop factor. So volume, what's the volume? 400 divided by what? The time in minutes. What's our minutes?
8 times 60.
480 multiplied by what's the drop factor? 60. There you go. That's how they got it. So divide 400 by 480 and then multiply it by 60, you'll get 50. Try it.
Damn it.
400 divided by 480 multiplied by 60. There you go. Okay, everyone got 50? Yes.
50.
Okay. Last one. Here we go. Intake calculation.
Oh crap. How much is a cup again? It's 32, right? What's one piece of toast mean? Oh. This is 480. Plus.
Yeah, the one. Oh, the toast? Alright, so what's the answer? 11. Did everyone get 1140? Yes. Are you sure? Alright, so let's go ahead and answer it. Now, before we answer it, don't forget, Jello, yogurt, right? They're all liquid, so they're counted. Right? The other thing, ice is only what? Half the ml. Okay, so if you have 40 ml of ice, how much is water? 40 ml of ice.
20?
Ice is how many water?
20.
20. And 1 cup is how many ml? Ounces? 8 ounces or 240
Oh man.
ml. Okay, alright. So, let's go ahead and calculate it. 4 ounces of clear soda. What would that be? 120. What would that be? 120. 1 piece of toast. 1,000. No, I'm just joking. That's not included. Right? 12 ounces of water. 360. 1 cup of Jello. What is it? 240. Alright, okay. Half a cup of chicken broth. 120. And then how much IV fluid? 300 for a total of 1140. So that's how it happens. Yeah, I know, it is hard. I wanted to show everyone how it's broken down. Are we clear, guys?
Yep.
Alright, let's go to dinner. Be back by 7.
Really?
Education administration, we're gonna go over the routes. Okay, so the different routes. So we're gonna go over first inhale or aerosol. Okay, so the sake of this, the main topic on this is actually on meter dose inhaler, or if you see it on our exit, MDIs. Okay, so meter dose inhalers. Now, very important. The main question in regards to the medication for this one is your bronchodilators. Your bronchodilators are already put in here. The names, you have albuterol or atropine or ipratropium. They are given primarily to widen the airway, right? From the bronchus primarily. Okay. So always remember that when it comes to bronchodilators, these are the ones that you want to give first before you actually give a steroid. Okay? And the reason behind that is because you want the steroid to be able to go in deeper into the airway. So you give a bronchodilator before you give a steroid. Now, the way that a bronchodilator is given is given in either the use of a nebulizer, or in this case, the question is related to an MDI or meter dose inhaler. So let's take a look at this. It's one of those questions. And the question is primarily on how to properly administer an MDI. So the nurse will report in discharge teaching to a client following an episode of status asthmaticus. Not a good thing, right? That's really bad. The client has a prescription for 2 inhalation of bronchodilators through a meter dose inhaler or MDI. Which of the following statement by the client indicates an understanding of the teaching?
C.
What do you think? Letter C. Correct. I will hold my breath at least 5 to 10 seconds after inhaling the medication. So that's
How
you want
many
to hold your
minutes
breath
in
because
between
you
do you
want.
wait?
I'm sorry.
How many minutes do you wait in between?
You can wait between the most is 1 minute. In between 30 seconds to 1 minute, you just have to do it. That's the best way. So that you can actually get the medication.
The second minute?
I'm sorry?
The second minute?
No, if there's a dose. If there's a dose of the same one, then each puff is between 1 minute. If it's a different medication, you have to wait 3 to 5 minutes. Correct. Yes, so if the question is a different medication, aerosol, MDI, 3 to 5 minutes. If it's the same medication, every minute. You just have to wait first. Alright, now, let's take a look. The other one, I will hold the inhaler with the non-dominant hand. That would be wrong. Why? Because we hold it with our
Dominant hand.
hand. I will tilt my head forward. That would be wrong. Tilting the head forward actually causes the airway to close.
Yeah.
So you actually have to tilt it what? Back. Okay? Backward is how you keep it open. Just like, when you're doing CPR. So don't forget, later on we're going to discuss about stroke. And one of the things we'll discuss there is the management of dysphagia. So don't forget, for dysphagia, that's when you do the head tilted forward. Okay, so dysphagia, tilt the head forward. But for MDI, tilt the head back. Okay, don't forget that. The other one, I will wait 10 minutes. Ooh, that's a long time. You better not take another one. It doesn't work anymore, right? After 10 minutes. Or hold your breath for 10 minutes. Alright, so this is it. I already put it here. This is what you have to remember in regards to the MDI. Proper administration or the sequence of steps to the use of MDI. Now, other than that, there's another one that I want you guys to remember, which is a device that's actually added to the MDI, which is
The spacer.
the spacer. What's the spacer for?
Make sure that the med doesn't get wasted.
Purpose?
So it doesn't waste the med.
To what? There you go. Prevent the loss of medication, or to increase the delivery of the medication, right? So you want to make sure that no medication gets lost, because a lot of times it's very difficult for a very young patient or for a very old patient to actually use an MDI. There's usually an error, and that error can cause a decrease, right, in the delivery of the medication. So if you don't want to have that decrease in the delivery of the medication, then a spacer can actually be used because this can deliver primarily all of the needed medication for the patient. So usually the ones that you will see using a spacer is either elderly or the very young. So don't forget, what's the purpose again? To deliver
This.
the medication.
Yeah.
Correctly the medication. Okay? So we want to increase the delivery, we're going to use a spacer. Right. So here's a sample of how they might ask it to you, right? In regards to administration of the medication via MDI. So this one though wants you to arrange it in sequence. Correct, order. So alright, so let's take a look. Which one do you think is first?
Shake.
Shake the canister 3 to 5 seconds vigorously, right?
Yep.
Yeah, you shake it like a Polaroid picture.
Exactly. He's still down. He's still down.
Remember that. That's all. Anything else? What's the next one?
Hey.
Letter.
Hey.
Letter
Hey.
A. Right? Place her lips firmly around the mouthpiece. What's next?
Inhale.
What's next?
Inhale.
Inhale. Correct. Inhale slowly over 3 to 5 seconds while pushing down the canister. What's the fourth step?
Hold.
Exhale. No, not exhale.
Hold.
Letter E. Hold your breath for 10 seconds. And last but not the least,
Exhale.
letter D. Exhale slowly through first lip. Okay, now the question is why first lip? Why? What's the purpose? Exhaling it slowly. But what do we eliminate more when we do first lip? CO2. Very good. You have the capacity to eliminate more CO2, relieving the problem with acidosis if you actually do first lip. Okay, so don't forget that. That is the purpose of first lip. You're actually eliminating more CO2 to prevent respiratory acidosis. Very good. Okay. Good job, guys. That's the concept why you yawn. You ever wonder why you yawn? Your breathing slows down, right? When your breathing slows down, what accumulates? When
Acid.
your breathing slows down, your respiratory rate, what
Acid.
accumulates?
Acid. Right?
CO2, right? Didn't we say what is an example of respiratory acidosis? Bradypnea or tachypnea?
Tachypnea.
Bradypnea.
Bradypnea.
So you yawn to release more CO2.
Oh, okay.
Alright, okay. Thanks, you're so quiet.
Oh.
Alright, next one. I am injection. Yeah, I am.
Vastus lateralis.
Alright, contraindicated to I am injection. What situation? Newborn, for newborn, although not really, newborn gets an IM, right? What else is something that's more contraindicated?
Hemophilia.
Thrombocytopenia.
Thrombocytopenia.
Very good. Thrombocytopenia. Right? And another one, very important, don't forget this, hospice patient. You don't want to deliver IM. Why?
Hospice.
It causes what?
Pain.
More pain. You want to maintain what for hospice and palliative patients? Comfort, right? So don't forget that, very important to know. Right? Contraindications to IM, thrombocytopenia, and hospice and palliative patients, especially because of comfort. For thrombocytopenia, because of the risk of bleeding. Right. Now, phytonadione, right, is something that is supposed to be given him, right? In this situation, though, it's to be given to a newborn. What would be the answer?
Hey.
Vastus lateralis. That's right. How about for an adult? For an adult, don't forget that's going to be a question for an adult.
Ventrogluteal usually, no?
It's the what?
Ventrogluteal?
Who says it's also vastus lateralis?
Yeah, I guess. If
Who
it's
says
developed.
it's ventrogluteal?
Yeah.
Who says it's dorsogluteal? Who says it's deltoid? Alright, so the answer is ventrogluteal.
Yay.
Don't forget this. It's gonna be on your exit. Okay. So this is how ventrogluteal looks like. There you go. Right there. That's ventrogluteal. That's the best site for adults. Right, so you do this. You do
Doing the
that,
squats, dude.
and you put the injection between the ring and middle finger. I mean index, sorry, index and middle finger. Okay. So ventrogluteal for adults, and for infants, what site again?
Vastus lateralis.
Vastus lateralis. Now the question is why there? You guys ever wonder why there?
There's less nerves or something, right?
Because of the sciatic, and the other one, the main reason is there's no blood vessels.
Oh, blood vessels. Blood vessels.
Which actually reduces the problem of what? Puncturing of blood vessel trauma. Right? So again, the best site is the ventral, although you see that the deltoid is the one that gets used the most. Why? No one really wants to expose the ventral. But for the test, what should be your answer?
Ventrogluteal.
Ventrogluteal. Right? So if you look at it, it is by the area of the greater trochanter here and the ischial spine. This is the greater trochanter, that's the ischial spine. So again, ventrogluteal. Alright, very good. Don't forget that, okay guys? Alright, and again, for infants, is the vastus lateralis. What are the two shots that's given to the newborn before discharge?
Hep B and vitamin K.
Hepatitis B and
Vitamin K.
vitamin
K.
K, or the other name?
Phenothione.
Phenothione. That's right. Very good. Okay, the next one. Nose drops. Alright, very important to know. Just the positioning.
That looks uncomfortable.
Sideline. Okay.
Breathe through your mouth.
Alright. Supine or side lying. Okay, guys. And don't forget, they also have to clean, of course, the nostrils before you administer the medication. And make sure that the patient doesn't close their nose. Okay. Alright. And after the medication has been administered. Okay? So just don't forget that, guys. The position. The best answer is supine. The next best answer is sideline. Alright. Okay, the next one. This one is easy. Eardrops. You already know this, right? Eardrops. Let's say, for example, for an adult, you want to put it on the right ear. How should you position the patient? Towards the left or towards the right?
Towards the
Towards
left.
the left. And then what? Pull back
Up and back.
Up. Don't pick out. Usually on the test it says out. If there's an option for back and up, that's the best answer. If there is no answer, there's no option for a back and up, then you can pick back and out. Is that clear? Is that clear? What's the best answer? Back and up. If there's no back and up, what's the next best answer? Back and out. Now, if the patient is younger than 3 years old, how should the ears be positioned?
Yeah, back and down.
Down. Very easy, right? Old up, young, down. Just don't forget that, okay? Again, adult, back and up. Young, younger than 3, back and okay, so there it is again. Your vastus lateralis and your ventrogluteal. One more thing, very important that they're gonna ask you. For the administration of iron dextran. Iron, right? It's given IM. What is the technique for
Z-track.
administration of iron dextran?
Z-track.
What do you call it? It's IM, but there's a technique.
Z-track.
Z-track. Z-track. Okay. How do you do a C-track?
You pull,
Place the skin,
poke,
inject the IM,
and then
let go of the
let go,
skin,
and then
remove the
yeah.
injection. The purpose of the C-track is two things. Don't forget this. One, to prevent the iron dextran from leaking.
Mhm.
And the other one is to actually promote comfort. Okay, now, what is the diagnosis for the administration of iron dextran? I ask you that. What is the diagnosis for the administration of iron dextran? Iron deficiency anemia. Very good. Okay, iron deficiency anemia. Now, the other thing they're going to ask you, if you are the nurse administering the iron dextran, what would be the best way to determine if the medication is therapeutic?
Hemoglobin.
Who said it? I heard it. Hemoglobin. H and H. You actually check the hemoglobin and the
Hematocrit?
hematocrit. Alright, average hemoglobin, although there's different male and female, average is 12 to 18, right? Hematocrit is 37% to 52%. Correct, very good. Okay. Because someone who's anemic, what would be their hemoglobin? If they're, let's say they're just mild anemia, it will be less than what? Less than 12. And their hematocrit will be greater than 37, less than 37, or greater than 52? Less than 37. Very good. So don't forget, anemic patient would have a hematocrit of less than 37% and a hemoglobin of less than 12. If the patient is given iron dextran, IM, C-track, then in order for you to monitor the therapeutic effect, you check the what? Hemoglobin and the hematocrit. Again, for the diagnosis of iron deficiency anemia. There you go. Iron deficiency anemia. Now, the next one, last one is going to be on anemia also. If the patient is taking iron, iron should be taken with what?
Vitamin C?
That's right, but there's something better, the best answer.
Orange
Not
juice?
really orange juice, but there's a reason behind orange juice.
Vitamin C?
C. There you go. It doesn't have to be orange juice as long as the patient is taking vitamin
C.
C. Okay. Iron is best absorbed when it is taken with vitamin C, but it is less absorbed if it's taken with milk. So it should not be taken with milk. That here, guys, do not take iron with milk. Take it with vitamin C. Alright? Okay. Next one. Digoxin, digitalis. Take a look. The nurse collecting data from a client prior to the administration of DIG. Okay, now DIG is a medication for the treatment of heart failure. Very good. Which of the following findings should the nurse report to the provider?
B. Potassium.
What do you think? The answer is
B.
letter. Alright, so the answer is letter B. Okay, so what? What?
Potassium. It's too low.
You guys hear that?
Hypokalemia.
Hypokalemia is a risk for digoxin
Toxicity.
toxicity. There you go. Hypokalemia is a risk for digoxin toxicity.
Toxicity.
Next thing that they'll ask you on interaction with DIG. which medication would have a negative interaction with DIG? What's that?
Furosemide.
Furosemide, what's the other name?
Lasix.
Why? Lasix is a
Potassium.
inhibitor.
Yeah.
Very good. It actually lowers potassium, which will result into higher risk of hypokalemia, which will result into a higher risk of digoxin toxicity. Okay? Don't forget that. I'll write that down.
2. Increase risk. Hypokalemia.
Okay? Don't forget. That's what happens. Right? You deplete potassium, you don't give them enough potassium, potassium drops, you want to make sure you hold the medication first, don't give it, right? And report that to the physician, because if not, that will actually increase the risk of digoxin toxicity. I'm sorry. Yep. Take that, spironolactone. Even though they're taking spironolactone, which is safer because spironolactone is a potassium sparing. Very good. But you also have to watch their potassium level because which is more dangerous? Hypo or hyper?
Hyper.
Hyper can actually cause cardiac. Yes. So don't forget, that's a question on your exit, that if the potassium is imbalanced, what is one of the things to monitor? Cardiac. Cardiac. Right? Cardiac should be monitored. Okay, is that clear, guys? Alright, very good. Okay, now, DIG. When it comes to DIG, it is a medication for heart failure. What is it supposed to do?
Stronger contractions.
The heart rate,
Heart rate.
to make the heart
Contraction.
stronger. Good. DIG lowers the heart rate but increases cardiac output. Makes the heart stronger. Right now, weaker. Right. But remember, there's a few things to make sure before we give it. One is the level of
Digoxin.
potassium. Right? We need to
Potassium.
make sure that the potassium is between 3.5 and
5.
5. Number 2, what else do we need to check? Apical pulse.
Apical pulse.
If your patient is an adult, it has to be above 60. If the patient is a child, above 70. If the patient is an infant, above 90. Very good. The third one, you have to check the digoxin
Toxicity.
blood levels. Correct. What is the normal digoxin blood levels?
0.5 to 1 point.
0.5
To 2.
1.2.
0.5 to 1.2.
It's alright. It's alright.
Switch.
0.5 to 2. Very to 2. Alright, very good. Okay, 0.5 to 2. 0.5 to 2. 0.5. 0.5 to 2. Okay, so don't forget that. So, always remember, if the digoxin blood level is 2.2, what would you do?
Withhold the medication.
Hold. Right. What if the digoxin blood level is 0.4?
Give the medication. Administer.
What do you do with the dose?
Increase or
What? You give it or hold it?
give it.
You give it. Right? Now, the next thing they're gonna ask you is that once you're monitoring the dioxin toxicity level, don't forget the manifestations. Okay, so what are the common manifestations of the toxicity?
Blurred vision.
What's that?
Halos.
Green yellow halos, blurred vision, nausea, vomiting, bradycardia before we go to cardiac arrest. Right? So don't forget, write it down. Those are the manifestations of the dioxin toxicity: nausea, vomiting, blurred vision or green, yellow halos. And the last one is bradycardia before we go to
Cardiac arrest.
cardiac
Nausea, vomiting,
arrest.
vision disturbances, halos, green yellow, bradycardia, blurry.
Alright, are we clear with that one? Very good. Last one before we go to the next bit. Antidote. What's our antidote for dioxin?
Digifab or something? Digoxin fab?
Digifan or something like that.
Digoxin fab. Digibine.
Fine. The other name is
Digoxin fab? Immune fab. Okay. Okay.
okay. That's the antidote. Digifine or digoxin immune fab.
Digoxin fab.
Good? The next practice. There in a nurse in a clinic is caring for a client who has heart failure and is taking dig. Which of the past statement by the client indicates the client is experiencing the dioxin toxicity?
See.
Better?
They were all yellow.
My vision seems yellow. What if the vision seems blue?
That's all.
Recommend
Alright, really quick. It's enough, really quick. The next med is clopidogrel. On your exam, this is also called Plavix. Who knows what Plavix is?
It's anti-platelet?
Anti-arrhythmic, other than anti-arrhythmic.
Anti-platelet, right?
Something else.
Platelet.
It's an
Anti-platelet?
Oh, platelet.
it's close, it's close. Anti-platelet. It's an anti-platelet. What does that mean? It actually prevents platelets from
Yeah.
aggregating
blood
and
clots.
forming clots,
Yeah.
which is a similar effect for what other class of medication?
Anticoagulants?
Don't forget, now it's easy to answer it, right? What do you think would be the answer here? Letter?
I can't even see. Yeah.
So don't forget, antiplatelets, antifactors, anticoagulants, right?
Contact.
The other one is thrombolytics. Those are all classifications of medication that
A.
prevents the formation of clots and is a risk for bleeding. Alright,
Lead risk.
now that will take us actually
A.
to the topic that we already discussed,
Thrombocytopenia.
thrombocytopenia. Always remember that for any patient that are on antiplatelets, antifactor, anticoagulants, and thrombolytics, watch them for signs of thrombocytopenia, which is bleeding. So please do not forget that. Okay? We clear? Alright, let's practice. The nurse is caring for a patient on a long-term heparin therapy. Upon checking the lab results, the WBC is 7,000 and the platelet is 100,000. Based on this information, what will be the immediate action of the nurse?
Yeah, vegetables. For the vitamin K.
Is our answer?
Vegetables.
Encourage?
Vegetables. Vitamin K.
So why encourage vegetables?
Vitamin K.
You're wondering, why encourage vegetables?
Vitaminas.
The WBC normal or abnormal?
Normal.
Platelet normal or abnormal?
Abnormal.
High or low?
Low.
Thrombocytopenic, right? So what's the benefit of encouraging vegetables?
Vitamin K.
Digestion and training, but there's another one that's more important. Yay.
Or vitamin.
Yeah. The first one is
Vitamin K. Vitamin K.
got it right. That's the important thing, right? Okay, here we go. Good job, guys. So the next one, that's going to be on our exam, the anticoagulants, warfarin or Coumadin, and the other one is heparin. There's one more though that's going to be on our exam, enoxaparin. What's the other name for enoxaparin?
Heparin.
Lovenox, correct. Lovenox. Good job, okay? Good job.
Enoxaparin. Lovenox.
Enoxaparin or Lovenox. Low molecular weight heparin. Okay. Swabdi, why are you?
Will be. Nurses! What up? Yay!
You did well.
Yes, and then have even improved since. How about that for stalking? Nice.
Went up 5%.
That's good. That's amazing.
Go to the
Isn't he
next
awesome?
10%.
Yes. Give him a raise.
They said that everyone's gonna pass.
Yeah.
Is that what they said?
Someone
Well, they
probably.
better make it so. They better make it true.
It will happen.
I just came to stop you all for a minute. That's all. That's it. Just for a hot second.
Uh-oh.
They were stalking me, and they knew what they were. I was like, they were
Right.
like, my class was like, I go, yeah, see, they love me. Ivy, come see me with us later, okay?
Uh-oh.
Make it happen.
Oh, guys, I'm in trouble. Alright, let's go ahead and do this. With our first practice.
Warfarin.
A patient of warfarin therapy has an INR of 4.5. What is the most appropriate nursing action?
Yeah.
Hold it,
Yeah, hold it.
continue, increase it, administer vitamin K immediately.
Yeah.
So the answer is,
See? Is that a C or D?
C. Very good. Hold the next dose of warfarin and notify the healthcare provider. Okay, so what? What's the reason behind this? INR, so
Therapeutic level needs to
very
be.
important, okay? For warfarin, or the other name is
Coumadin.
Coumadin, there is a specific lab test called
ETINR.
INR, growth time, and the other one is international normalization ratio, right? So between the two, if you see this on your exam and they're both there on the option, the best answer is
INR.
INR. Okay, so don't forget that. Even though they're together, the best answer when it comes to lab tests for the therapeutic effect of Coumadin or warfarin is INR. Now, the normal range where we want the patient to be once they're started on Coumadin or warfarin is between 2 to 3 seconds, right? 2 to 3 seconds. That's the therapeutic range. Right? You want them to be at that range because that's the safe range wherein the patient is not going to form clots, but at the same time they're not at high risk for forming clots, and at the same time not at risk for bleeding, right? Okay. Now, if the patient, take note, ever drops their INR and it becomes less than 2, this is a risk for clotting. Good. But if their INR climbs up, depending on their Coumadin dose, this will be a risk for bleeding. Right now, by knowing those risks, it's very important because another thing that they will ask you is, if the patient's INR drops and they're at risk for clotting, what does it tell you about their medication, which is Coumadin?
This is too low?
Dose is not enough or too high?
It's not
Too low.
Too low, right? Very good. Okay. So dose is going to be low. And here, the dose is probably what?
Too high.
Right? Here, the dose, you give it. Don't hold it. It's low, right? But here, the dose, you what? What do you do with the dose? You hold it.
Hold it.
Right? Okay. Less than 2, you don't hold, you give it, but you still tell that to the physician. But if it's but if it's greater than 3, what do we do with the dose? Hold it. Right. Now, assess for clotting, assess for bleeding. Right now, what do you think would be another expected order from the physician if the patient has signs and symptoms of bleeding? What's the antidote?
Vitamin K.
Vitamin K. Okay, or what's the other name for vitamin K?
Phytonadione. Phytonadione.
I know what I see.
Alright.
That's
Hey.
slow down.
No question or question? Question.
It's vitamin K. Phytonadione.
So just in case, very important to know, if they gave you ET, don't forget that the critical value is greater than 20. Any value greater than 20, that's a critical value, means the patient is going to be at risk for bleeding. Okay, that's for ET. Okay. Is that clear, guys? Alright, thank you. Okay, so let's take a look at it. The nurse is reviewing the initial activated partial thromboplastin time and pro time for the client experiencing toxicity to heparin. Which of the following results should the nurse expect?
B? I don't know what APT is.
So, B?
I'll say B.
That's our answer. So, there's a technique, right? If it's asking for heparin, then you can already eliminate A and B.
Yes.
You only have to pick between C and D.
So C.
And its toxicity, so the answer would be what? It will be
But
why did I eliminate PT?
it's for work.
That's for Coumadin. Right, so you shouldn't be using PT for the purpose of heparin. Because for heparin, you test it with PPT or APPT. Okay, now the critical level, therapeutic level for PDT is between 30 60 seconds. That's a therapeutic. Critical level is what? Greater than
Then 60.
70.
Oh, 70?
Good. It's 70. Okay. It follows the same concept. If the patient is less than 30, this is a risk for clotting. If the patient is greater than 60, this is a risk for right? Dose is probably low.
Yeah, high.
Dose is probably high. And what is the antidote?
Protamine sulfate.
Protamine
Sulfate.
sulfate. Okay. Protamine sulfate. That's the antidote for heparin. Protamine sulfate.
Okay.
Alright. Any question on heparin? No. You're good, right? Alright, very good.
So iron value is in. So iron value for
No, INR is good.
That's for
4 point INR. Alright, let's take a look at this. A patient's PT is 18 seconds with a normal range of 11 to 13 seconds. What does this suggest about the patient's anticoagulant status if they are on warfarin?
C. Too high?
You guys forgot our number.
20.
So what does it suggest?
Therapeutic?
that's normal.
Yeah. Yeah, it's either therapeutic. Yeah, it's either B or C. Oh, nilagay ko rin yun.
The answer is
B?
the patient's warfarin dose is therapeutic.
Right.
Okay, go back to your book. 11 to 13 is the normal PT if they are not on. They are
Warfarin.
not on warfarin. But once they're on warfarin, that should what? Double to either 1.5 or 2 times. As long as they don't exceed what?
20.
What's our number?
20.
20. Did the patient exceed 20?
No.
No. So the patient is?
Therapeutic. Okay.
Gotta remember the numbers, okay? They might show it though anyway on our thing.
Oh, tama ka
It's
nga
up to you to interpret. So don't forget, even though they show you the value, that the critical number is what? 20. If it's greater than 20, so what if I change this and I put this to there?
Too high.
What's the answer now?
C.
The patient's warfarin dose is?
Too high. How do you get too low then? Ha?
Ano range ka normal?
Hindi nyo sinabi, alam kung 11 to 13 lang yung normal person pero walang
Everyone got
walang
it?
medication.
What if I change this to 9?
Too low?
It's too
Too low?
low. And now the patient is at risk for
What? So it's 11 to 20 then?
Very good.
Sa tingin ko 11 to 20.
Does anyone have a question?
30.
Some of you, like I see, like, long
Kasi
life.
18.
Yeah.
Just don't want to ask.
So what's-
Ask. Don't be ashamed. Don't
So
be
what's the
shy.
lowest that you can be?
If it is within, yes, then the answer would be within the normal range. That means they're not really taking any medication, but they're not because they're actually taking which is good.
So what's the normal range if they're taking warfarin?
When you start taking Coumadin or warfarin, it actually should multiply your normal range by 1.5 or 2. But it should not exceed 20.
Okay.
It should not exceed.
So depende daw. 0.5 to, yeah.
It's still good. 19, we're still good.
Okay.
I think it's on your page, on your book, page 170.
0.5 to 1.2 or
0.5
times 1.
A patient on a direct oral anticoagulant has a PT of 11 and an APTT of
Hindi yung-
35.
Okay.
What does this suggest about the anticoagulant therapy?
5.5 to 1.5 diba? Warfarin. Okay, got it. Thank you.
So, the DOAC is likely not having an effect. Why? Because they're still within the range of not having any anticoagulant. There's also maybe this, the patient may need to increase the dose of the DOC. But you see, like, you don't really know the actual medication dose. So, it's likely that it's not having an effect. Why? Because they're still within that range that they're not
the
taking
normal
an
range.
anticoagulant.
Okay.
Very good, guys. Alright, just one more thing on this question. A nurse is caring for a client who has thrombophlebitis and is receiving a continuous infusion of heparin. The client asks the nurse how long it will take for the heparin to dissolve the clot. Which of the following responses should the nurse make?
C.
The answer is letter
C.
C. Heparin prevents new clots from forming rather than dissolving
Established.
established clots. Alright, so since I'm here, they're gonna ask you this on MedSurg with the use of IV fluids. They're gonna ask you to differentiate
Versus phlebitis. Infiltration. Malamig yun. Yung phlebitis, remember itis.
I'm
Mas
gonna give you
mainit.
examples. You tell me where it goes in, whether it goes to infiltration or phlebitis, okay? Erythema.
Erythema, phlebitis?
Erythema. The term erythema, what does it mean?
Redness.
Red. Where does red go in?
Phlebitis.
Here, because that's red, this one is actually pallor or pale,
Pale.
right? Pale. Okay. Swollen. Where does that go in? Swollen.
Infiltrate. Well, both, no?
Swollen. Puffy. Swollen and puffy.
Infiltration.
Infiltration. Phlebitis is tender. Right? Tender, painful. How about warm to touch? Where does that go in?
Phlebitis.
Phlebitis. And this one would be. Okay, so don't forget that. Okay, and always remember that if there is a situation of infiltration of phlebitis, we stop the
Infusion.
infusion immediately. Right? Remove the existing infusion and change the location of the IV site. Okay, so don't forget the description. Okay. So infiltration is described as pale or pallor, swollen and cool. The vitis would be erythema or red, tender, and don't forget the description. Okay, so here's just some information about the anticoagulants, alright? Please don't forget about it, so you can read on everything that we discussed. Right. Now, another one to remember, they will be asking you on interaction between your over-the-counter pain medication, which is acetaminophen, aspirin, and NSAID. Don't forget, the one that causes more bleeding, if taken with someone who's taking anticoagulants, is aspirin and NSAID. The one that is less contraindicated is acetaminophen. Okay, don't forget that, because they're going to ask you on drug interaction. So don't forget, acetaminophen is the safest for patients who are taking anticoagulants. The one that you don't want to give them is aspirin and NSAID. Also, remember this, garlic, ginger, glucosamine, and ginkgo can increase the risk of bleeding. Okay? Alright guys, take a break. We will be back by 8:15.
Okay.
Do your break.
Sensory.
And okay, you go and check the banyo. And just joking. Not go there. I will not go there. That's the problem. Alright, here we go. Atrial fibrillation, so don't forget, right? Anticoagulants for the purpose of preventing blood clots from forming. If there is an existing blood clot, it is for the purpose of preventing it from getting
worse,
bigger. Alright, so prevents it from getting bigger. Now, as I mentioned, NSAIDs and aspirin contraindicated for patients who are taking anticoagulants because it puts them at the risk for bleeding. Good job. Okay. Now the safest would be acetaminophen. All right. So that's something that we have to put into consideration. If the question comes out on what would be the best management for pain if the patient is on anticoagulants. Okay. So it has to be acetaminophen based. Alright, let's take a look at this one. So on aspirin, a nurse in a pediatric hotline receives a call from a mother who plans to administer aspirin to a toddler for a fever and wants to know the dosage. Which of the following statement by the nurse is an appropriate response? Letter
acetaminophen.
Now in this situation though, don't forget, this one is more of preventing race
syndrome,
which is a risk for individuals that are younger than 18 years old. If they have a fever and you're not sure whether it's viral, bacterial, fungal, right, or parasitic, don't give aspirin. Because if it's viral, most likely it's going to cause what? Race, right? So don't forget that. Very important to know. Okay? Aspirin, do not give for younger than 18. Especially children, toddlers. That one is a toddler, so yeah, that would be too much. Race or Rye syndrome is a damage to the blood vessel that can cause problem with circulation. So you don't want that to happen because of aspirin. Also, don't forget, aspirin is also a risk for tinnitus. What does the term tinnitus mean?
Ringing at the ears.
Ringing at the ears. Alright, next one. This is also there, but this one is for acetaminophen. Which of the following patient would the nurse identify as being at highest risk for acetaminophen toxicity?
What? Acetaminophen.
Who is that? Good job, guys. Correct. Hepatitis because of the
Liver.
So don't forget, it's very specific. The way they're gonna ask you is, what's a contraindication to acetaminophen? Think of something related to
Liver.
Okay? Think of something related to the liver. If it's related to the liver cirrhosis, hepatitis, fatty liver, right? That's the one that you actually don't want to give acetaminophen. Other than that, alcoholics, you also don't want to give acetaminophen. Why? Alcohol is already damage to the liver. Okay? Please don't forget that. Okay, they're gonna ask you
Metal toxic.
contraindications to acetaminophen. Again, liver damage. Okay? Liver damage. All right, very good. Okay, so don't forget about acetaminophen.
Oh God.
Okay, next one. Let's take a look at this also. Something that's also related to acetaminophen. A nurse is caring for a client who reports daily use of acetaminophen to manage mild knee pain. Which of the following statement by the client should the nurse investigate further?
The wine? I want to say the wine.
Fabi says it's egg.
What was that? Correct. So please don't forget the answer is letter D. Okay, why? Acetaminophen
Because it already
plus
has
another
acetaminophen.
acetaminophen is toxic. So don't forget, there are different levels of toxicity for acetaminophen. Let me show
Wait.
you.
Why is it bad?
Here it is. So there are limitations. The average is 3,000 milligrams per day or 3 grams. Although the limitation is through 2 grams for those who are taking more than 3 servings of alcohol daily. Okay. So don't forget that. Very important to know. Patients who are taking also products with acetaminophen, it's contraindicated because they're going to go over the limit. And that can
Bless
cause
you.
what? Further, bless you, liver damage. Okay. Please don't forget about that for acetaminophen. Getting there. Don't forget also, here's another one. Please highlight this
Acetylcysteine.
on your PowerPoint. Acetylcysteine is the antidote, okay, for acetaminophen toxicity. Good. Next one, narcotic. This one is not that hard. Let's start. A nurse is collecting data on a client who has a prescription for morphine. The nurse should recognize that which of the following data is the priority to obtain before administering this medication. Respiratory rates. Okay, respiratory rate. Now, when it comes to select all that apply, just in case, then
The pressure, respiratory.
because it's all affected. What it does is, for ABC, it lowers the blood pressure, lowers the heart rate, lowers the respiratory
Respiratory
rate.
rate.
And remember, it's sedating and can also cause drowsiness. Okay. Alright, next. Related also to narcotics. A nurse is caring for a client who had a total hip arthroplasty 1 day ago and is receiving morphine sulfate by PCA pump for pain control. The client reports nausea and vomiting. Which of the following action is the priority for the nurse to take initially?
Osculate. So initially,
The
you got
answer
it.
is?
It says, yeah, osculate.
Good job. Auscultate the
Sense.
Okay. Really quick, I just remembered this. Good thing that this question came out. There is going to be a question on our exit they're gonna ask you to describe hypo and hyperactive bowel symptoms. Okay, please don't forget this, okay? Okay, so don't forget, they're gonna ask you that. Between the two,
What is to hyper on the wrong time?
between the two, which one is hyping?
What?
Vowel sounds.
And then this is low pitch. And the one that is greater than 30 per minute, of course, hyper.
Hyper.
And this one would be less than 5.
Less than 5.
Less than 5. Please don't forget, they're gonna ask you that in the description. So hyper, high pitch, more than 30 per minute. Hypo, low pitch, less than 5 per minute. Okay, this could indicate diarrhea, this could indicate constipation.
Hypo is less than 5 diba? Less than 5 per minute. Low pitch. Got it.
Good? You guys wrote it down? Okay, so the next one is the antidote for opiate toxicity. Antidote is Narcan or naloxone. And for the rehab medication, it's
Methadone.
okay, methadone.
Wait. Methadone.
Okay. So here are the other complications. Please write it down. So just in case you don't have the option for respiratory depression, and then you don't have the blood pressure and the heart rate, you can also take note of the other effect of the medication causing constipation, orthostatic hypotension, and urinary retention. Please don't forget that. Those are the other effects of your narcotics. Pharm is very direct. You really just have to memorize.
Tension. Urinary tension.
Guys will be able to answer. Okay, so our next one, propranolol. So I mentioned that there is one specific beta blocker that's going to be on our exit, and this is the one, propranolol. So remember, propranolol as a beta blocker, it has 2 applications. It can either be used for hypertension, but at the same time, it can also be used for dysrhythmia,
Oh, this is
right? Dysrhythmia. So, as an antihypertensive med, the way the propranolol works is that this will lower the heart rate to lower the blood pressure. And as an antidysrhythmic, it just what? Lowers the heart rate. So make sure that the heart rate is between what? 60 to 100. Okay, 60 to 100. Right now, the way the medication does that is that propranolol blocks a specific receptor, which is the epinephrine receptor, right? It blocks it. So when it blocks it, epinephrine cannot attach, and that actually cancels out the effect of epinephrine. Right now, there are things though that we need to be cautious about on contraindication. Something that if you see the patient with this diagnosis, you should tell the doctor, hey doctor, maybe you shouldn't prescribe that because the patient has this diagnosis.
asthma.
So, what do you think here that's on the list, and then we'll add some more that's contraindicated to beta blockers? It's very good. Right answer. Heart failure. Okay. So heart failure is one. Other contraindications are COPD, asthma,
COPD, asthma,
pneumonia, and diabetes. So why diabetes? Because you can't actually see hypoglycemia if they take beta block.
Best.
Just remember, one of the signs and symptoms of hypoglycemia is tachycardia. Now, if they're taking beta blocker, then
Yeah, we'll see the tachycardia.
okay, so it actually masks hypoglycememia. Now, other than that, the question is, why is it contraindicated for COPD, asthma, and pneumonia? Because it causes
Bronchoconstriction.
bronchoconstriction. Okay. Causes bronchoconstriction. Okay, so you want to be very careful. You want to make sure that the doctor, does not forget that the patient has COPD, asthma, or pneumonia, so they should stay away from prescribing what? Beta blockers. There's one more thing. That's a blood pressure med that's going to be on our exit.
ACE inhibitors.
Inhibitors, right? ACE inhibitors. What are examples?
Grills.
Lisinopril, captopril, enalapril, right? Altopril. Yes. All right. So what they're gonna ask you is adverse effects.
Angioedema, cough, elevated
Nice. Did you guys hear that?
potassium.
No, you did, right? So, what are the adverse effects? Let's go over it. Angioedema, right?
Dry cough.
Yeah. Nagging, chronic, dry cough, right?
Elevated potassium.
It can cause elevation of
Potassium.
potassium, so dangerous for cardiac situation, cardiac patient, right? Okay. Other than that, orthostatic hypotension. Okay, so orthostatic hypotension, that's another one. And in males, ED,
Orthostatic
Oh.
erectile dysfunction. There you go. Don't forget, okay, ACE inhibitor is gonna be there. What are our examples again?
Lisinopril, captopril,
enalapril, all the pril. Okay. All the pril. Okay. Next one. Blood transfusion. So, it's not really it's hard because you have to memorize a lot. So, the way they ask blood transfusion is, I have a list here, right? What they do is they'll give you the signs and symptoms and they'll ask you what it is. So it's kind of hard to remember. So try to remember as much as you can and what type of reaction that is. Here's an example of how it can react. Let's take a look. A nurse is assisting to monitor a client who is receiving blood transfusion. Which of the following findings should the nurse report to the charged nurse as an indication of an allergic blood transfusion action?
A,
Letter
A,
because urticaria means
itching,
hives, welts, right? Rashes. Pruritus means
Itching.
Itchiness. Very good. Okay, so that's how it's gonna be. So just try to remember as much as you can on the signs and symptoms and the type of reaction. Okay. And what do you do in the case of an
Stop the infusion.
reaction?
Stop the infusion.
Drop and roll, right? That's for a five.
Stop the infusion.
So, anaphylactic reaction, just FYI, this is one of the worst and most deadly. But it happens usually in the very first 15 minutes. That's why, the first 15 minutes of the blood transfusion, the nurses states.
Yep.
Okay, because of the high risk for anaphylactic reaction in the first 15 minutes of blood transfusion.
Oh,
Right?
okay.
Okay, here. Next one. Almost there, and then 2 more minutes, and
Which are the follow?
you can start med search tomorrow. Alright, a nurse is assisting with the care of a client who has severe preeclampsia and is receiving magnesium sulfate IV 2 grams per hour. Which of the following findings indicate that it is safe for the nurse to continue the infusion?
B?
She seems normal.
It is safe to continue the transfusion.
Respiratory, right? Huh?
The answer is
B?
letter B.
Okay, yay.
So don't forget, magnesium sulfate, which is a medication to prevent preeclampsia from becoming
Eclampsia.
eclampsia, right? So preeclampsia, in other medical terms, it's called maternal hypertension. While eclampsia or eclampsia is maternal seizure, right, which is deadly. Both the mom and baby can die of eclamptic seizures, right? So to prevent preeclampsia from becoming eclampsia, they give magnesium sulfate.
Sulfate.
Now, they have a big question on this. It's in OB. What is the assessment to determine? Why do I sit down? It's because I have to show you. What is the assessment that you need to do in order to determine if you need to give magnesium sulfate? Sitting down. You can do it with sitting down. What do you do?
DTR?
You check. Yeah.
Deep tendon
Okay.
reflex.
So one is knee jerk,
Yeah.
right? And the other one is ankle. Ankle. Why? If the patient is going to go from preeclampsia to eclampsia, what happens to the knee and ankle reflex? It's going to be what? Hyperreactive.
Hyper.
Hyperreactive.
Yeah.
Hyperreactive nerve is a sign that the patient
Hyperreflexia.
is going to have a seizure.
Yeah.
Right? So, because of the hyperreactivity of the nerve, that is one indication for the possible administration of magnesium sulfate to prevent the mom from going into maternal seizure. Because if the mom goes to seizure, both mom and baby can die. Right? That can happen. So to prevent that from happening, give magnesium sulfate. The problem though is magnesium sulfate is toxic.
Yeah.
Because it is toxic, you have to watch carefully the mom's what? Vital signs, primarily the respiratory status. Okay, you also want to watch the deep tendon reflex, because if the deep tendon reflex is gone or diminished, that could also indicate magnesium sulfate
Toxicity?
toxicity. So, what's the antidote?
Crap, I forgot what it was.
Calcium gluconate.
Oh, yeah,
Very
calcium.
good. Don't forget, okay, write that down. Calcium gluconate is the antidote. Magnesium sulfate.
Need to administer magnesium. Hyporeflexia.
Calcium.
Medication.
Okay? So don't forget that. Very, very important to know that.
Sulfate. Toxicity. Okay.
Very good. Any question on magnesium sulfate? No? Alright, we're gonna move to the next one.
Eh?
A nurse is caring for a client who is 2 hours postpartum. The client has an IV of lactated ringers with large amounts of rubra lochia. Lochia rubra, right? We have 3 different lochias, right?
Yeah.
Lochia rubra, serosa,
Alba.
with a hypotonic or uterine atony. Vital signs includes a blood pressure of 146/94, pulse of 80, and respiration of E. Which of the following prescriptions should the nurse clarify with the provider? You're the nurse. What order would you say? I want to check this out.
A. I forgot what this does, but it's the only one that makes sense.
Now, before we answer that, is the woman bleeding or not?
Yes.
Yes, she is.
There's
She's
large
suffering
amount
from
of
postpartum
hemorrhage.
hemorrhaging. Okay, because of a hypotonic uterus, which means uterine atony, right? So, for uterine atony, before we go for, more advanced treatment, we can do first what?
Fundal massage.
Tell them to empty their bladder,
Oh, yeah, that.
right? Fundal massage, breastfeeding, right? We do that. Ambulation, right? But if those doesn't work, what can we do? We can ask for an order for
Pitocin. Pitocin.
pitocin, oxytocin, metergyne, or methyl ergotamine. But there's a problem. This is something that you need to clarify. Now, this is actually the answer. But you're probably wondering, well, aren't we supposed to give that because the patient is bleeding? But why is it though that you will question it?
Oh, yeah.
You cannot give methyl ergotamine for an elevated blood pressure because they might stroke out instead of. Okay? Why? Because methyl ergotamine, there are other names to this, right? What are the other names? Pitocin, oxytocin, the other one is metergyne. They're all the same. They're just different names, but they are all the same. They are all what? Vasoconstrictors for the purpose of preventing what? Or stopping postpartum
bleeding.
hemorrhaging. The problem though is because it's a vasoconstrictor, it can elevate the blood pressure. And if you're not watching the blood pressure, this can go really high and the patient can stroke out. So in this situation, you want to ask the doctor first. You really want this to be ordered because the patient's what? Blood pressure is already elevated. Okay, is that clear, guys?
Yes.
Okay, the next thing they're gonna ask, if you are to give this, how do you determine the therapeutic effect? What do you do? What do you do? If you give metergyne, you're the nurse, you gave it. How would you determine if it's helping with the patient?
Check the fundus, check
The
the bleeding.
fundus is firm, that yes, or the nurse will, or the patient will verbalize what? I'm having painful cramping contractions. Very good. They're supposed to have that. As a postpartum mom, they're supposed to have contraction or painful cramping of the uterus. Why? Because that's when you know the uterus is getting smaller. It's shrinking. It's involuting. If they don't say anything like that, we have a problem, right? Because that's probably going to continue to bleed. So, you want the mom, as soon as you give this medication, to tell you that they're what? They're having painful cramping. Okay, that they're having contractions of the uterus. Or you will notice that the lochia rubra is what? Less. Yes, there is a decrease in the amount of the lochia rubra. Are you clear with that one? Alright. So don't forget that in regards to this medication, what vital sign are you going to check?
Blood pressure. Check the patient. Plates of painful.
Alright. Next one. The nurse is reinforcing teaching with a client that has a new prescription for a sublingual nitro. Now, very important to know, on your exit, they are not going to call it nitro. They're going to call it
Isosorbate. Dinitrate.
There you go. isosorbide dinitrate. So that's on our list, right?
What is that?
Okay. So isosorbide
Nitroglycerin.
dinitrates. Nitro. Okay, now nitro comes in two forms that gets used the most, right? One is sublingual and the other one is
Subdermal.
Sublingual is for emergency acute. Patch is for prophylaxis. Okay, so even if they have a patch and they suddenly develop chest pain, don't remove the patch. What do? Keep the patch and give them sublingual. Okay, don't forget that. If they already have a patch and they develop chest pain, don't remove the patch. Give them a sublingual together with the patch. Okay? The purpose of that is it will help open up the blood vessels more so that blood can go where? The heart. Okay? To stop the angina or possibly, reverse an MI, myocardial infarction. Now, the question. The nurse is reinforcing the teaching of the client's new prescription of nitro. Which of the following instructions should the nurse include in the teaching? It's letter B. Lie down upon onset of chest pain. Alright, why not A? Because you take nitro
Every 30 minutes. 30 minutes
5
apart.
minutes apart,
5
right?
minutes apart?
3 times 5 minutes apart. That's the administration process for the time. 3 times 5 minutes apart. Okay? Don't forget, 3 times 5 minutes apart, not 10. Take with a full glass of water. No. Because it stays under the tongue. Okay, now, if their mouth is dry, you can tell them to drink some water first before you put the nitro under their tongue. But not when it's already there. Okay? You don't take it with a full glass of water. Now, do they have to take it on an empty stomach?
No.
No. They have a heart, they have a chest pain. How would you know if they have an empty stomach or not? So no need for water, no need for an empty or full stomach. And do they swallow the tablet?
No.
It stays
Sublingual.
under the
Tongue.
Okay. Alright. Next one. If the patient though is having a myocardial infarction and not an angina, don't forget, okay? Mona, this is the treatment for heart attack. Mona.
Morphine.
Morphine.
Oxygen.
Gin. Correct. Nitro and
Yes.
aspirin. Okay. This will come up. Mona, which one do you give first?
Oxygen.
Not in sequence. It's not in sequence.
Oxygen.
Which one you give first?
Oxygen.
Follow your rule of prioritization. What?
Oxygen.
Correct. Oxygen. You give oxygen first. One. All of those 4, oxygen is what you give first. Okay? Oxygen is what you give first. Airway, breathing, circulation. Oxygen is what you give first. Oxygen will do a lot of good for this patient. Although, of course, you're still going to give what? Morphine, nitro, and
Aspirin.
Okay, now, when we go to med-surg tomorrow, we're going to talk about EKG and the process of identifying stents. So, but for the meantime, we'll stick with this, which is very important. Alright?
Heart attack yan, diba?
Ha?
Heart attack.
Alright, next one. Almost there, guys. Take a deep breath.
Chlorpromazine. Oh, EPS.
The nurse is collecting data
Second.
from a client who's taking chlorpromazine Which of the following findings should the nurse identify as an EPS? Now I'm gonna check. What did they say was the tool to evaluate EPS?
Aims.
AIMS. What does AIMS stand for?
Abnormal involuntary muscle
Normal, voluntary,
movement. Six. Yep.
So, the question is, which of the following findings should the nurse identify as an EPS?
A, B, and E. A, B, E. Yeah, let's do A, B, E.
Okay. I'm gonna give you a clue so that you know how to answer this on our exit. EPS. Think of the definition of AIMS. It's a what? Abnormal, voluntary movement. So what are the answers?
A, B,
B,
E,
and
E.
D? Sexual dysfunction? It's what? A and E. Good job. That's the trick, okay? EPS are all abnormal, involuntary movement. It doesn't involve any vital signs. You know what involves actually vital signs? Which one? It's another one. It's the what? Not the extrapyramidal though. Vital signs. Neuroleptic, malignant, cyst. We'll discuss that. Neuroleptic, malignant,
Scale.
MS. So EPS, how will you remember it? They're all
Aim.
abnormal,
Involuntary
voluntary.
movements.
Good job, guys. There you go. Yeah, but where's Alicia Lava?
I got your flush.
Flush?
I think she's going to